so much, Heidi. And I promise we are cognizant that we are what sits between you and lunch. But this really is going to be a wonderful conversation today, and overall a really important conversation that we believe needs to be had. So thank you for joining us as we really focus on our discussion today about improving maternal health in these hard-to-reach populations, which we believe is not only both timely, but critical as well. Currently, we are living in a moment where the data and the stories behind the data really point us towards the urgent truth. Too many women, especially those in rural areas, in low-income communities, in communities of color, they really face significant barriers to receiving maternal health that they not only need, but that they deserve. As in this room, as healthcare leaders, as policymakers, practitioners, and industry experts, we really have both responsibility and the opportunity to all come together to bridge these gaps. And that really begins with the honest conversation that we're going to have here today as a room and as a collective. The thoughtful strategies and the partnerships that are rooted in equity are not only important, but again, are timely as well. I know we've already introduced these wonderful ladies, but I am honored to be on this panel to be able to moderate the conversation that we're having today. Unfortunately, Dr. Sheila Woodhouse, the Senior Medical Director from Vheda Health, is unable to make it, so I'll be kind of chiming in with a few programs and points on her behalf as we go throughout. But today we're going to explore how we can better support mothers and really overall birthing people in those hard-to-reach populations, that these women support, as well as really focusing on care coordination, culturally competent interventions, and innovative partnerships as well. But before we get started, we do want to connect with you all and have you interact with one of our first poll questions. Randy, if you wouldn't mind. We really ask that you participate in this poll. Understanding kind of where everyone is in the room allows us to really kind of tailor our conversation today and really help kind of drive what we're going to discuss throughout this panel. We'll give you just a minute to get up and running. Hopefully there's no issues. So first, we are asking that you are ranking in order of importance your focus on these key initiatives, again, initiatives all surrounding maternal health. Looks like we've got some strong responses coming in. Kind of neck and neck is providing the whole person care for vulnerable populations, as well as promoting access to safe, gold standard patient care. With that in mind, Dr. Price Stevens, we would love for you to kind of kick us off and really talk more about the focus and some of these key initiatives that DMAS has for us.
Well, thank you. Hello, everyone. Right before lunch. How are we today? I can hear you. Hello, everyone. Thank you. So, first of all, before I get started, I have to acknowledge that yes, I'm the Chief Medical Officer for DMAS, but I am just a representative for all the great work and all the great people who work in our agency. Many of them are sitting over there. You can wave your hand. If you're part of DMAS, can you wave your hand? There you go. Maternal care is near and dear to us. We have incorporated maternal care into everything we do. Whether you're talking about eligibility, pharmacy, policy, our care coordination, or cardinal care, I mean, every step of the way we have incorporated maternal care. We know that we impact and influence, and I know that you have done the same thing too. So when we sit here and we think about all of the changes that are going on at the federal level and the state level, how are we going to do it? And here they have a nerve, Heidi, to have a panel about another problem. When we have, what they say, 99 problems, and is this another one? The way we do it is that it takes a village. It's not just your CMO, your pharmacist. It's not your president or your CEO. It's going to take everyone within your fiber, everyone within your organization. So as we think about the daunting task of what are we going to do about maternal health, haven't we done enough? think about all the great things that you do already, and think about the village within your organization. So I'm going to start there too. In addition to acknowledging our DMAS team, I want to acknowledge you. This has been an awesome partnership, and Director Roberts and I didn't get together and convene on our talk, but we actually have the same theme, and that is thank you. Thank you for the partnership. So we talk about our Baby Steps program, which is a program that we utilize to improve maternal health outcomes for all pregnant and postpartum women and work to eliminate health disparities and also decrease maternal mortality. We have done a lot in that space, but we couldn't have done it without you. So that's my love song. Director Robert likes The Bachelor, I love love songs. So my love song is, I couldn't have done it without you. So we think about that we impact 1 in 3 births in Virginia. Said another way, we support women who are the creators, the ones who are giving those 1 in 3 births. That sounds daunting, and that comes with a lot of accountability, but I want you to know that we couldn't have done it without you. Nationally, Virginia is one of the leaders in maternity care. People come to us, talk to us, how did you do it? What did you do? What was your partnership like? We were one of the first states to extend postpartum care. In 2022, women enrolled in Medicaid and CHIP who were pregnant individuals have guaranteed continuous coverage through 12 months postpartum. That is huge, guys. Couldn't have done it without you. We were also one of the first states to implement a doula program. In June of 2022, DMAS launched the Community Doula website and enrolled our first certified doulas. Guess what? We couldn't have done it without you. You also have supported programs that are dental care for pregnant women. And we also talk about putting your money where your mouth is. Year over year, you, our MCOs, have invested more and more each year in financially in our maternal care programs. Not only financially, but also your time and your tools. And Director Roberts talked about partnership for Petersburg, was just an amazing example. You did things like diaper drives, food banks, the community hubs, and those Saturday clinics that were hosted by Dr. Brazell and her team. You were there in full force. We actually asked you to come out only once or twice a month, and what? You were there daily. You were there weekly. So you know what? We just couldn't do it without you. Thank you. So last but not least, I also want to talk about how you made a difference, and we talk about data. All the work that you did is shown in the data. When we looked at our postpartum follow-up in 2019, Virginia Medicaid was at about 61%. Nationally, it was 76%. But now in 2023, you have increased that from 61% to 74%. Guys, that is huge, and we couldn't have done it without you. When we look at the national standards, they went from 76 in 2019 to 80. So we still have a ways to go, but even compared to the national data, Virginia increased our numbers in 4 years, more than what's been done nationally. So I want you to think about, when we talk about this tough topic, all the great things that you've already done, and that's through partnership. So right now, give yourself a round of applause. But with that, you know there's work to be done. Through our governor's executive orders, we know that there are still maternal mortality out there. There's still areas of opportunity. It looks like we have made some inroads in that. About 2 years ago, we had about 30 women, raw numbers, who actually died related to childbirth, and now those numbers are in the teens, down to 17, but that's still 17 too many, right? There's so much work to be done. We know that there's increasing disparities among women of Black and brown race and ethnicity. We also know that there are pockets of Virginia that the maternal care, there's a great opportunity. So when we talk about the Eastern Shore, Allegheny, West Piedmont, the Shenandoah area, those are still areas of opportunity. So as a director from Governor Youngkin's, we have convened the DMAS MCO task force that is led by Director Roberts. And that's where we're intentionally partnering with you on the opportunities in maternal care. DMAS is also aligned with the CMS Affinity Group, where we're focusing on cardiovascular care, the Ask About Aspirin campaign, as well as some of our behavioral health initiatives such as postpartum screening. All those things are still underway. So when we come to you today with the title, how do we improve maternal health in hard-to-reach populations? You could be saying, we're already doing so much. What else is there to do? So I'm going to invite you to look at the breadcrumbs. So I think we have a live feed here. So part of the governor's directive was for the Virginia Department of Health to update their website. So I would encourage you to, you can even pull out your phone now and go to the website, and I don't have the exact handle, is it up there? You put VDH Maternal Health Updates, and you'll probably see that if you Google that. And we talk about our maternal and child health indicators. And one thing that I found most interesting is to look at the late or no prenatal care. So I don't have to show you the data or cite any of the medical literature to tell you that if a woman does not get prenatal care or she has late care, that results in adverse outcomes. Does everyone agree with that? Can I get some names? Right? Absolutely. So if you look over since 2015, the last 10 or so years to 23, we've been kind of flat in Virginia for prenatal care. And on average, I just want to let you know bad is blue. So if you see bad, blue, that is bad. But on average nationally, it's about 7%. 7% of live births in 2023 nationally were to women receiving late or no prenatal care. So when you look at that number for Virginia, you say 5.8%, hey, not so bad. We're beating the national average. But if you look further, and I think that my friend in the back is going to hover over, Manassas City, they're at 40%. That means that 40% of the live births, people there do not receive any prenatal care or they receive late prenatal care. And you know that correlates with the outcomes of the lives of those women, also the births of those children. We have counties that are at 0, we have some that are at 40%. Manassas City, Williamsburg City, Bristol City, all up above 20%. So I would encourage you when you ask yourself, what else can we do? Where can we go? What are the hard to reach places? Utilize the data and follow the breadcrumbs. This is just one of the sources. And so as we get together with our affinity group, we work together with our teams that are going to be looking at cardiovascular care, we are going to be intentional, just like we were with Petersburg, and follow the breadcrumbs on where we go next. So I ask you, what do we do? But I do know for sure, I can't do it without you. I'm going to turn it over. So Dr. Whonder-Genus said she had all the answers. I'll turn it over to you.
It is my pleasure to sit here as a representative of the managed care organizations here in Virginia. But I want to clearly state that any work that we do here at Anthem is the same work that's being done across the board by every managed care organization here. Whether you're in Medicaid, whether you're in the line of business for commercial, all that we do is to impact the lives of Virginians. And so as I sit here and talk a little bit about what we're doing in Anthem, I want everybody to just take that picture and put it on yourself. And also, in order for us to do the work that we do, we require partnerships. And so I also want to acknowledge the partners who are here in the room who help us do our work so well. Whether you are a pharmaceutical company, whether you are HR looking and engaging or unable to contact members. All of you are doing something worthwhile and helping us as an organization, as a group of individuals to help those that we have been called to help. So that being said, Anthem had about 10,000 live births in 2024. And one of our goals, obviously, is to ensure that each one of those births are healthy, that the mom who goes through that pregnancy goes through a healthy pregnancy, and then also is able to continue well-being past her delivery date. 30% of our deliveries are by C-section. Most of them have been repeat C-sections. And again, with any surgery, there's always risk and benefits. So if we can lower that number, that would be great. We look at our preterm births. They're about 10% across the board. And when we look at those 10%, about 10% of those are low birth weight babies, and about 3.6% of them are very low weight babies. These are the individuals who are ending up in our ICUs, requiring a little bit more attention and care, but that also means that mom has to take time out to take care and to be attentive to these babies in the ICU. So that is also part of our work that we're doing around maternal health. We look at the maternal morbidity rate, and in Virginia, we're, for Anthem, it's about 3%, and that's 3% too high. I think about a mom who I was just looking at her chart the other day, 29-year-old who delivered her baby 9 months ago and developed cardiomyopathy, which is where her heart is just not working as well. And here we are 9 months later, and she still had a heart that was only functioning at about 15%. How do we impact this mom's life? How do we help her understand that she's a ticking time bomb, and she could drop in a heartbeat because her heart function is that low? What is our role to ensure that she gets the care that she does? We try reaching out to her and stay unable to contact her. And yet, we're persistent. All right? And I'm happy to announce this particular mom, we did reach her last night, and we are able to get her back into case management and make sure that she is following up with her cardiologist. But that's what we do, right? It's nothing special that Anthem is doing. It's what each one of us is doing, whether we are reaching out individually or we're working together to make sure that this mom has the opportunity to survive and take care of her family. One thing I have noticed, though, when we talk specifically about rural health, is that rural health, in a lot of people's minds, are associated with increased risk of substance use disorder. And what we're seeing is about 8% of our moms are having issues with substance use disorder, which leads to about a 14% number of babies born with neonatal abstinence syndrome, primarily in the southwest region of our Commonwealth. So as you looked at some of the previous slides, the bottom part of the state, which kind of borders onto Tennessee, is what we call Appalachia, right? That's where everybody knows that the opioid epidemic really took its roots and has really been a force to be reckoned with as we're trying to navigate that particular part of maternal health. So how are we able to influence the care that's being given in these rural areas? What are the barriers? You know, we've got transportation, we've got access to care, we have this lack of health literacy. And how do we help our moms in these rural areas understand the need to address these barriers without making them feel less than they already sometimes feel? We're trying to collaborate with physical health and behavioral health teams to ensure that together we're addressing the whole individual. This is all about whole health. So we have virtual programs where we have primary care OB practices that are virtual, which allows our moms to access these cares at any time throughout the day, morning, noon, or night. And what we have noticed actually with this particular vendor that we're using, that about 15% of the patients or the care is being given in areas of rural access problems. Did I say that right? Yes, I think. So we're using this as a model to gain access for our moms. They're very excited about the opportunity to address both the physical health and the behavioral health needs of these moms. We're looking at life skill building, and when we rolled this out a few years ago, the whole intention was to engage moms who are struggling to make sense of life, right? Whether it's how they got to their appointments, whether they knew the importance of going to their prenatal visit, whether they even knew how to balance a checkbook so they could have, who balances checkbooks anymore? Let me take that back. Who just how to function in life. And interestingly enough, nobody was fighting. And so we've changed the name. And we're now addressing, the sense of whole health. This is now being called Total Wellness Navigation, where we're looking not at building skills for your life, but how to integrate all that you need for mental, physical, emotional, spiritual health. One of the other things that we're looking at to support rural areas is, again, addressing some of the social determinants of health barriers. One of them is access to food. And so we have a food as medicine program that's launching this year, specifically for our high-risk moms and with their pregnancies. And this will entitle them to have access to registered dietitians, medically tailored meals, medically tailored groceries, all with the hope that a well-nourished and healthy mom is going to have a healthy pregnancy, she's going to have a healthy baby, which will decrease all of the adverse outcomes that we are seeing with preterm birth, substance use disorder, neonatal abstinence syndrome, low birth rate, very low birth rates. We're looking also to ensure that we can help fill in the gaps with maybe some enhanced transportation, continue our collaboration with our community-based organizations in doula care, peer support groups. Like, how cool would it be to have a doula who's also a peer recovery specialist?
Very cool.
Thank you.
That was a rhetorical question. Okay, all right.
Absolutely, right? We have a need, we identify a need, why don't we fill that need with the people who can do that? And what does that take? It takes education, it takes financial support. We're supporting some of our community colleges with doula programs, education. We're doing partnerships with community service boards across the enterprise, across the Commonwealth. That's what we're all doing, is it not? And we should continue to do so. And so for me, I just want to take the opportunity to just say our MCOs are doing their jobs. We're making an effort to impact lives, not just for today, but for generations to come. Thank you.
Thank you so much. We heard some wonderful insights from both of these ladies, specifically at DMAS, like Dr. Price Stevens shared, the Baby Steps program. The fact that they're overseeing 1 in 3 births, I mean, it's a huge, huge weight to carry. When it comes to Anthem, in 2024, supporting 10,000 live births. While we know there's still some room that you shared for improvement, primarily around C-section rates, primary C-section rates, NICU reductions. Again, that's why we're all here today, to have these conversations, to become one in a room, with like-minded individuals sitting next to us. Knowing that these were some of the goals with both these organizations, again, we'd like to hear from you with our next polling question. Think about your role, think about your organization. What is the single biggest maternal health problem that you need to solve in Virginia?
And while they are,
Please.
just wanted to go back. I know with, after we get finished with the poll, we'll look at that map again and look for areas, opportunities. But it's so interesting that we're seeing the come up access to care. That is probably the single access to care and engagement. Okay, make up your minds, guys. Access to care is still shining as through. It's the thing, the opportunity. So you think about, here we put the challenge, the task. What can we do in those areas where they're hard to reach, where it seems to be difficult? We're just not moving the needle just yet. We have the map, we have the breadcrumbs to tell us maybe where we need to go. You're even acknowledging that access to care is important. But something you said really resonated with me. You said case management. And I could hear Tammy Whitlock saying care coordination. What's the difference? And will that move the needle what we're trying to do? I understand what case management is. is, and I understand what care coordination is, but we hear that time and time again. I participated last week in our statewide maternal mortality review board. I can tell you all of the unfortunate women who reviewed their case or the reason why they passed away associated or related to childbirth. Almost everyone was a Medicaid member. But the point was, they were given an appointment, but no one followed up with no appointment. They went to the emergency room. I saw Colin here, I talked about the EDCC. You know, we've got to use the EDCC. We've got to make sure our hospitals, our providers, and our payers are coordinating. They did that, but no one could reach the member. All of these things are part of case management, but where are we on care and the care coordination? So that is a question. You have mics out there. We want this to be a dialogue. Where do you see the opportunities in these hard to reach areas? People who have been assigned a case manager, but where do we bring in the care coordination for access to care? Just be curious.
Sure. Care management is not one person, right? So care management, I'm gonna take your words, Dr. Price-Stevens, is a village. And it involves people from different parts of the industry, okay? So it can't be just the doctor, right? Or just the doula, or just the care manager, or the PCP, or the transportation person. It really has to be a collective work that needs to be done. And I think it's important for us to realize that wherever we sit in the industry, it's important for us to do our part. And when we do our part, then I think the walls start to come down. So a physical health provider should not be afraid to talk to a behavioral health provider, should not be afraid to talk to the transportation coordinator, should not be afraid to talk with the doulas or the pharmacists and say, you know, we're having a really hard time addressing problem A, and this person is always in your arena. Why are you not talking to them about problem A? I don't see them but once every 6 months, if that much, but you see them every 6 weeks because they're picking up medicine, say for a pharmacist, right? Why don't we empower our pharmacists to do a little bit more education? And education goes a long way, right? Because once somebody knows that there might be a problem that affects them and their family, they may be more engaged. I thought member engagement was there as well, to say to somebody, okay, how do I access that care? And what does that mean for me where I live, where maybe I don't have internet, so I can't use telehealth? Well, maybe we could do mobile vans or whatever it is that would work for that individual. So I think it really is a collective work towards educating our members, educating our providers, and together we come up with solutions that will work for that individual and the community at large.
Wonderful. Well, thank you so much, Dr. Whonder-Genus. As I mentioned, Dr. Sheila Woodhouse from Vheda Health was unable to attend, but knowing some of the focuses that you all shared from our last poll, access to care, member engagement, continuing to be some of those strong focuses in order to see the outcomes that we're all working towards and to see those pieces begin to fall into place. With that, I'll share some few comments on her behalf. But Vheda Health is a virtual engagement organization, really focusing on connecting with these hard-to-reach members, providing them resources through technology, through human touch, by providing iPhones, devices based on conditions to really focus on remotely monitoring these members, monitoring them with real-time preventable interventions, driving towards these outcomes that we've all been discussing today. Primarily that engagement, average 84% engagement rate, which is huge for this hard-to-reach population that we've been discussing today. Focusing on not only the prenatal visits, the postpartum visits, and really driving towards the increased gestational age at delivery as well. In follow-up, we will be sharing not only some of the data and slides that Dr. Whonder-Genus shared, but the link to the website that we also walked through for the state of Virginia, and then some program details on Vheda Health as well. So you guys will have all those resources easily accessible. But kind of as we wrap up this conversation today, we'd like to do one last polling question. I promise this is the last time I'll ask you to get those phones out, but we've had some great dialogue, some great conversation, hopefully really kind of getting everyone thinking in the room. We're just re-asking the first question. So based on the conversation, just want to see if if any mindsets have shifted. When we first answered, we really saw some high focus on promoting access to safe, gold standard care. Up there, also high was providing whole person care for vulnerable populations. Just want to see if thoughts have shifted and kind of where we stand after the conversation. So we'll give you a minute or so to put in the polling questions and see if we're still aligned or if anything has changed. And if so, that's wonderful too, right? That's what we're here for, is for this conversation to be thought-provoking.
I was about to say, strengthening the health of the family was moving up,
And it is.
but then it fell down. Oh, it's back up.
It's kind of fun to see in real time how we feel and where we stand. But looking across the board, I mean, the fact that all of these key initiatives are really neck and neck, I mean, that continues to tell us, I think, that there's a lot of work to be done. I didn't come up here, I don't think any of us came up here with the mindset that we were going to solve maternal health in these 30 to 40 minutes today, but to at least get that conversation going. We've heard a lot about these hard-to-reach members. We've heard about the programs that support them. What we haven't done is actually heard from one of these members that we're talking about. So we'd like to share a quick video on just what additional support and connectivity during such a vulnerable time can mean to a member within this population.
The next question is, how has having the Vheda phone and devices improved your health?
Oh, it improved my health?
Mm-hmm.
It helps improve my health because it allows me to check my blood pressure, just track it, and so I can show, like my primary care providers, I was showing my OB/GYN, just to give them, some reassurance that I am checking my blood pressure, the medication they're prescribing is working good, because, nobody has time to just stroll in the Walgreens, stick their arm in the machine. You can do all that at home on a daily, 3 times a week, so that way you'll know, your doctors know that you're managing your blood pressure well.
Right, absolutely. How has the Vheda Health program affected your confidence in taking care and addressing your health care needs?
Oh, as an African American woman, it has really boosted my confidence. We really, on an everyday, we just blood pressure's high, let me just drink some water or sit down or get out in the sun, We're really apprehensive when it comes to medication. And for a moment, I was apprehensive when it comes to it came to, taking blood pressure medication and things like that. But with the help, support, and encouragement of the Vheda team, they got me started, and they just kept calling and supporting me, step on that scale, check that blood pressure. And it's just like, I'm a visual person, so seeing a green, happy face from my blood pressure, it just made me feel good. I don't have to go sit in a triage for 6 hours with a newborn. I can just go about my day knowing that my blood pressure is good, and I'm gaining weight, even though I got to do 14,000 things a day.
Thank you for allowing us to share that. I would like to give each of these women some opportunities for some closing remarks. And Dr. Whonder-Genus, I'll start with you. If there's any additional notes you want to add to challenges that you guys have overcome, successes that you've seen out of these challenges, we'd love to hear it.
I think each one of us, wherever we sit in the industry, we have success stories. Let that success drive the work that you do. Because when you work and save one, you've done a great job.
I will end up like I started, that even with the poll, you talked about access to care, the family unit, it's things that you wanted to improve upon. You've already done that. You have a success story, and all the work that we did together, couldn't do it without you. An example is Petersburg. So now use the data the state, our agency, we're being transparent with the data, we're sharing more, we're diving deeper into the data. Go to the sites and follow the breadcrumbs and decide where you as a collective will go next. And as you said, we can't do it without each other. It takes a village, but the agency, DMAS, we are here to support you, and we appreciate all that you do. So there's a lot going on, right? We got cardinal care, we've got stuff going on with bed. Don't lose your focus. Like I tell my kids, focus on your focus. And our focus is taking care of our members. We've done great work with maternity care. Let's continue to do the work. Let's not feel defeated that it's too hard, because guess what? You've already done it. What you basically say is next. What's next? Let's do it together.
Thank you. And before we do open up the floor for questions, I of course want to thank our panelists today for sharing your insights, the experience, your visions, and thank you in advance for your questions and for your participation throughout. If there's one thing we know for certain, based on the conversation, based on the interactions today, it's this: that improving maternal health for these hard-to-reach populations isn't just a clinical challenge, it's a collective one. It requires us to really rethink how we engage with our communities, how we design our systems of care, how we hold ourselves and everyone next to us in this room accountable for both equity and access. As you leave here today, as a panel, we want to challenge you. Challenge you to take just one concrete step today, whether it's forging a new partnership with somebody you meet here at the conference, whether it's rethinking a policy, maybe it's just elevating the voices of those most affected, like you heard in the video shared today. The work truly is complex, like we've discussed, but the goal is clear. Every mother, regardless of geography, regardless of income or background, deserves not only the opportunity to thrive before, during, and after childbirth. So again, I would really challenge you and ask you to kind of think this through. Let's not allow just today to be a moment of awareness,